My pleasure.
Today we have Dr. Shamik Ghosh, who did his basic medical schooling from Neel Ratan Sarkar Medical College in Kolkata. His passion for pediatrics led him to rigorous postgraduate training in the subject from the Armed Forces Medical College in Pune and at the Institute of Child Health, Calcutta. Dr. Ghosh further pursued his PG training in the UK at various institutions, including Newcastle University and the Liverpool University. Dr. Ghosh has successfully amalgamated his training in India and the UK to render care with emphasis on good communication skills. He is currently a senior consultant pediatrician with Bhagirathi Neotia Women and Child Care Center, Newtown and Columbia Asia Hospital, Salt Lake. He is also the panel pediatrician of the West Bengal Commission for Protection of Child Rights. Thank you so much, Dr. Ghosh, for your time on a Sunday morning. And since I know you
My
are
pleasure.
one of the
Entirely
best
my pleasure.
pediatricians that we could have reached out to, so really, once again, a pleasure. So before we start and before we get into insights, one particular question that I would like to ask in general is for the general safety and general measures. So people are aware about wearing masks, using sanitizers, and washing your hands. So my questions is again, it's related exactly to your field. So what do we do with infants and toddlers who cannot wear masks, whom we cannot give masks, whom we cannot use sanitizers, and suppose we do have to take them out. So let's say they do still have to go out for vaccination or some unforeseen event occurs, and we do have to take these children out who are below the age where they can wear masks. So how do we ensure, that they are safe, and how do we, manage them?
Thank you, Suchi, for a very relevant question. Since March, I think so, we've been in the midst of this pandemic, and very little was known about the virus in the month of March, which was discovered only in late December. And preventive measures, what are the treatment options, and what is the role played by different individuals in transmission, the methods of transmission, everything was a haze. I mean, there was nothing very crystal clear. 7 or 8 months down the line, there are things which are crystallizing now from whatever was nebulous in the month of March. And let us get some facts absolutely straight. Now, number one is this a pandemic? I think so. The question is definitely it is a pandemic and it has affected millions all over the world. How much does it affect people? The elderly, the ones with multiple comorbidities, are the ones who are especially susceptible. The healthcare workers who go to the front line and are treating patients, they are even more susceptible than the general population because of the high viral load. So they have to exercise extra caution. And being a pediatrician, obviously, we get asked this question very, very commonly by the parents as to how much at risk would I put my child in if I have to move out? And what are the consequences of an infection in a child? I shouldn't say thankfully, but it has been observed that children are the least susceptible to this particular virus for various scientific reasons, which we won't get into now. I think so. The key take home message needs to go across, and that is that children are the least susceptible. Most infections in children are either asymptomatic or very mildly symptomatic, just like any flu like symptoms. But what is important about children is if they get infected, they act as a vehicle or a carrier for the germ to other members of the family. So if you've got elderly parents or grandparents or other relatives in the house who have multiple comorbidities, that even if the child is asymptomatic or even mildly symptomatic, transmission of this particular virus to this elderly person, uh, it can cause grave consequences. So children basically play the role of carriers in more than 99% of cases. Yes, there is less than 1% chance that children can have some serious manifestations of the disease. Let's keep that out of the discussion because that is a very minuscule minority, all right? But what is important for everyone to realize is that children need to be protected from the virus because they can be the carriers for serious illness in the rest of the family. Now, like you very correctly mentioned that, very small children, toddlers, infants, they would not be in a position to maintain hand hygiene. They will not be in a position to what you say, wear a mask, okay, or they would not even be in a position to practice any cough etiquette. So, what is very, very important is that we have to minimize exposure to the outside world. It's easier said than done, like you've mentioned, that if there is an emergency requirement like a vaccination, which is an essential service. So, in that kind of a situation, we as doctors, we take as many safeguards as is possible and we do not advise any delay in the vaccination courses because if you are unprotected from things like flu or from a pneumococcal vaccine, the breakthrough illness can be even more dangerous. So that minuscule chance of infection that this child has, we try and minimize that by giving them staggered appointments. We try and minimize that by telling the parents to come at their appointed time to the clinics where there isn't any overcrowding. We try and separate the febrile clinics from the non-febrile clinics so that the children are not exposed. And we do pass on a message back to parents that please minimize movement out of the house to only the basic essential and one services, right? One of the essential services is vaccination. Other than that, if you are unwell, yes, you have to visit your doctor. Social visits, any other visits where the child might be exposed to a crowd, so to say, that is what we would like to tell you not to do.
So thank you very much. That was
Okay.
quite insightful, and yes, as you rightly mentioned, we also have observed that children, the numbers affecting the children have been almost negligible, and I think what we have also seen is the recovery time is quite faster in children in asymptomatic few children who did unfortunately get affected. Uh, so do you think that this would ultimately, though it is a very long shot, but it might lead to some kind of herd immunity, later on as the time progresses and it's there, for a long time? Is there a chance for herd immunity developing from the children, passing on to the adults?
Yeah. So that's a very, very good question, Shuchi. And let us get these facts clear. Like, as we are going along the pandemic, newspapers, media, they are flashing the words herd immunity, innate immunity. So let us put it down in very, very simple terms. So, what is innate immunity? Innate immunity is something that you're born with, right? Okay. It is something that you and me have as a natural protection against any illness. And what is a herd immunity? It is the immunity that is developed on exposure to a particular pathogen or to a particular germ. So the key word is exposure. Now, if I have to allow herd immunity to develop by natural exposure in a country of 1.34 billion, if the majority of people have to acquire herd immunity through a natural infection, we are inviting disaster, right? Because we have a fairly sizable section of the population which is elderly. We have a sizable section of the population which is diabetic, hypertensive, having lung disease, right? Okay. So even if the percentages are something like 10% or 15% or 20%, in absolute numbers, if you take that as 1.34 billion, then what is going to happen is that the absolute numbers would far exceed the resources that we have in our country. All right, okay. So acquiring herd immunity through a natural infection, like Sweden has so successfully done, is not an option for a country like India. We have to maintain our social distancing, we have to restrict our movement outside, and we have to prevent the natural infections to the extent that is possible. The herd immunity will really develop, we have a chance of developing quickly in India once the vaccine is available. Because the vaccine is going to induce an antibody response which will last longer than even the natural infection. As you must have known, the natural infection immunity, the antibodies, they are not lasting for more than 3 to 4 months. We are increasingly getting reports, that people are getting reinfected. I have one classmate of mine from another medical college serving in the army. He got reinfected in a matter of exactly 3 months. And when it happened to him, we were all very surprised. And this is as late as September, first week of September. So thereupon, the world has, since first week of September, today is middle of October. Now the numbers are increasing. So again, natural infection for developing herd immunity possibly isn't a very good option. We have to hope and pray that the vaccine comes into the picture as soon as possible so that we can inoculate as many people as possible and elicit an immunity which will last longer than the natural infection. And only when about 70 to 80% of the population have detectable antibodies in their blood, only then we can say that we have achieved a herd immunity. So realistically looking, we are looking at something, say about a year or a year and a half from now, when the vaccine would be available to each and every citizen of this country.
Yeah, that's really very insightful, because people, as you rightly said, people are using these terms, looking at things, and they have made their own definition, or they Google it, they go to WebMD, and they think that they are aware of all the medical terms. So yes, so that is exactly what I wanted to know. So opening herd immunity is not an option in India, because it's a huge uncontrollable population due to that. So as far as vaccination is concerned, so we'll finish this and then we move on to another part of what you said, over to the festivals, wherein avoiding crowds and all. So that's a point of today's discussion. But before that, I would like to know vaccination. So as a medical practitioner, do you see vaccination coming very soon, or even when we are talking about schools, when we are talking about children, especially today? So the schools have been, they are still contemplating if they should open by the end of this year, which of course, being an educator myself, I don't really see that as an option. And we don't see it probably towards the end of next year, in fact. So for another year, we don't advise it advisable. But from a doctor's point of view, and someone who is involved in all of this, do you think vaccination would, and of course, we have to give some time for the even though the after the trials are conducted, do we have to give some more time to see how the vaccination is actually working in the whole population in the country as such, or is there any repercussions coming forward because of that? So what is your take on vaccinations being introduced into the market?
Thank you. Thank you. Very, very relevant today. Uh, First and foremost, since this is a public platform, I think so we need to get people to understand what is a vaccination. All right, okay, and how does a vaccination help in controlling an illness? Now, obviously, vaccinations, scientists would be spending their precious time, energy, and money on developing a vaccination when a particular illness has the potential of causing death or disability. Something like tetanus, something like rabies, something like diphtheria, we don't get to see that in the modern day world. Why? Because most of the population has been vaccinated with this. So these are illnesses wherein if the germ were to enter my body, even today, standing in the 21st century, we cannot claim to offer any tangible treatment to people on these particular illnesses. So, the first basic principle which everyone needs to understand is that the vaccinations can only and only and only come in when illness has the potential of causing death or permanent disability like polio, right? The next is, what are the steps to develop a vaccine? The steps would first be to identify what is the gene makeup of that vaccine, of that particular germ, what can be done to counteract the multiplication and the distribution of this particular genetic makeup in the population. So the geneticists play a very important role. The next is, we would have to be injecting them into certain animal models and then conducting human trials. Now, what people have to remember is, today we are free of polio. Today we are free of tetanus. Today we are free of diphtheria. We are free. We don't see so many cases of rabies. But the vaccines against them have only come up after years and years and years of rigorous trial. Some vaccines were not even very effective when they were first introduced. For example, the typhoid vaccine. When you were a child, I was a child, my father would inject me with an extremely painful typhoid vaccine once every 3 years. And yet I could suffer from typhoid. From the 70s to now 2020, we have a typhoid vaccine where a single dose after 6 months of age is sufficient for lifelong immunity. So the process of refinement is a continuous process. So as far as coronavirus is concerned, what has been the time lag? December 2019, the germ was identified. WHO named the germ in middle of January. The genotype, that is the genetic makeup, sometime in February. And within 15 days, with all due credit to the World Health Organization, despite all the flack that they keep receiving, they initiated all the research. And more than 400 companies in the world today are having funded research as far as the coronavirus vaccine is concerned. There have been epidemics of similar coronavirus previously known as MERS, known as SARS-CoV-1, previously affecting the Middle East countries and other countries. They weren't pandemics, but they were epidemics. So we do have some information about the kind of antibodies that will be required to combat this particular virus, and that might expedite the production of the vaccine. What we must remember is, whatever is discovered, whatever is manufactured, has to be injected into a human being. And two things need to be looked at: whether the antibodies, once they are injected into the human body, they are persistent for at least a year, and whether they are causing any serious side effects or not. So once we get clarity on these 2 points, it is only then that we would be able to say safely that after giving vaccination, we will be safe enough to combat this particular virus. So, if I have to look at the timeline, then what is it? The vaccines are presently in the human trial phase. By the end of the year, early next year, possibly some of them may be getting a license, all right, which is actually a scientific marvel, because from discovery till licensing would be a year, which was unthinkable, say 20 years back also. But then once it comes into the market also, the first recipients, we would have to wait for a year before we pass a judgment on which vaccine is more effective and which vaccine is less effective. So, friends, please be prepared, despite all the hype and the hoopla about vaccines, that 2021 will be a year where you have to be on your guard. The vaccine may come in, it may be injected to a lot of people. There may be a lot of volunteers who are willing to take the vaccine for whatever protection it provides. But whether we are going to be safe or not, the whole of 2021 has to be passed. Only then, sometime in 2022, would we come to know that whether we have acquired enough herd immunity.
So this is a very, very excellent point because that's the reason I asked about vaccinations because people are so excited, and in fact I have seen people saying that 15th August was the deadline, why it has not happened. Unfortunately, being even so advanced, so educated, we are living in times when people don't understand that everything has a process, everything has its own timeline, own measures to be taken, and we cannot rush these kind of things for of course, for the sake of we probably have cause more damage rather than repairing something else. So this was very, very important that we needed to put it out today, that just because a vaccination is out, people should not start taking things very lightly and start living as if nothing had happened, and go back to 2019. So yeah, this was very, very important. So now coming to
Shruti,
the main point.
can I just, before we go on to the
Sure.
next point, okay, can I just make a very important point, a slightly contrarian point, but it's very important. Mind you, we are in the midst of a pandemic, all right, okay, and people's lives have changed unrecognizably. People who are daily wage earners, people who are being forced to, cut down on everything other than basic expenditure. There are people who have had their relations, who have lost their relatives. So psychologically, Shruti, to be very, very honest, I think so. If a person in this kind of a situation is looking for a magic potion, right? Okay, we as a country, we do not have very robust social service systems in place. All right, we have all the laws in the world which don't get implemented. So, as an ordinary citizen, I pray for a ration. I pray for a medical service. I know, prayer is not going to get me well, but I pray that, let there be some miraculous intervention so that my life can be saved. So, as long as we have respect for the right to live of every citizen of this country, I, for one, as a doctor, I take no umbrage, and I am never upset by a patient asking me a question, Doc, when is the vaccine going to come? I can perfectly understand their mental state. Their children are confined to their homes. They can't go out to a park. They can't go out to meet their friends. They aren't able to meet their grandparents. Their income has slashed down by one-fifth to one-tenth. So it's all a cumulative build up within themselves, which is making them sound helpless. And in these helpless times, if a person, I mean, this program is all about looking deeper than what's there on the surface. We are looking at the emotional wellness of our people also. It's very important that an educator like you or a doctor like me, we need to give these people a very, very patient hearing. We need to tell them that, look, you and me are in the same boat. We all are hoping and praying for a miracle. The positive things are today the treatment is better. Today, 28 years of age, she had a dengue infection, had a massive, cardiac problem. I thought I would lose her. She has pulled through with multiple comorbidities, which is unthinkable in the month of March. So I do tell my patients that, look, we have given ourselves time to improve our medical facilities. We have given ourselves time to improve the care that we are rendering. We have enough to hope for in the future. And just like you're praying for a vaccine, we are also praying, not just praying, we are putting in our best efforts to provide some succor and some relief to people who are not just physically, but time at an all-time low.
So
Yes, Suchi, are you there?
yes, yes, yes. So yeah, so when you spoke about
Okay,
the
okay.
emotional wellness of people, I completely agree because I see when I talk to my clients also, I see that anxiety. And in fact, I was just talking to someone day before yesterday, and we were just talking about the lives that COVID has claimed. And I happen to have this idea or thought that we are just counting people who were affected by COVID, but who were infected by COVID rather. But so there are people, there are older, in fact, unfortunately, I have been one of those families who has lost family members due to indirect, due to anxiety, due to heart attack. So yes, so I think these death also can be counted as COVID death, maybe not infected by COVID, but due to the anxiety or due to the uncertainty of things that is happening. So there's been a lot of increase in abuse also, which domestic abuse, domestic violence, which has also led to some kind of a um, in uncertainty in people. And I think those also should be considered as COVID related losses as well. So yes, absolutely, we are living in very very difficult times, and we but yes, these points are also pertinent to be put out to people, so that we, as you said rightly, we are hoping, we are praying. So prayer is nothing but a hope and a faith that all will be fine. But we also have to have that patience till everything is actually fine, and not just because we are praying and we have a vaccine, it doesn't mean that it's perfectly fine at this point. It would take its own time, and we have to hold on to that hope till everything goes back to pre-COVID times rather. So the last the main crux of today's discussion, the festival. So with festivals coming, of course, people always love festivals, because again, festivals are a symbol of hope, of faith, of positivity. And yet we are living in a time where we are unable to give our 100% to these to the festivals. And in certain cultures, we do have, though this Navratri, the 9 days, is the time when people prefer to go out and do things. But me also, myself, being from the similar community, we have these specific days, where we go, we do puja, we have to, our elders have always taught us that we have to go give pushpanjali, we have to pray to goddess. If not all 9 days, we have specific days, the ashtami or the navami, or these are the days where it is of more importance, and we have to go out. So how do you what do you suggest, when especially people who are probably there are so some people are more I don't know, maybe either religious, or some people, or it's a part of their life, or it's a part of their identity that they do have to go out and perform this puja. So what are the precautions if they at all do want to go out and on at least 1 day or 2 days of during this festival time, or even later, as a Diwali is just around the corner? So what is your suggestion, that if they of course, not going out is one of the options, but if they do have to go and if they do have to participate, is there some additional precautions that they should be taking, or how should they take it ahead?
Shruti, I think so. This is something which is being hotly debated, and it's there in the newspapers, it's there in almost every forum. So let us put a proper spin to this whole thing. Yourself as an educator, myself as a doctor, somebody else as a politician, somebody else as a fire service personnel, somebody else as a police personnel. We all have our own, beliefs as far as religion is concerned, as far as festivals are concerned. And what is very important for us is to take cognizance of and respect the other person's sentiments also. Okay, I might be a doctor, I might be a complete atheist. I might be looking at festivals as nothing more than a social get together, a cultural, manifestation of what we are. I might be looking at festivals irrespective of religion. Eid will appeal to me much more, as much as Christmas might appeal to me, or an Onam might appeal to me. But what is very, very important is that We have to put everything into the right perspective. What and what we can do is we cannot force people. We have to develop, I mean, people like you and me who are on the public platform, who are in public service, our communication skills have to improve to such an extent that people will listen to us. And we have to use every available platform, every available opportunity to tell people that, look, we completely respect your sentiment for a festival. We completely respect your need to interact with society at large. We are all social animals. I cannot spend my life in splendid isolation. Today, as a doctor, I need to have a very good and positive interaction with a psychologist, with an educator, with a police person, with a legal person, everybody, right? So it's very important for us to have days in the calendar where we can, we are guided by the community to interact. The whole year we do spend, interacting with a small close circle. These are occasions where we interact with a larger group and we make a lot of new friends, which actually adds to my positive mental health, right? But this year, this act, for all its positivity, has some inherent dangers. And the danger is in the crowding and in the overcrowding. The danger is there because India, if I may say so, imposed the lockdown at the right moment, if you were to take everything into consideration, in the very, very early stages. And we imposed the lockdown in the third week of March. The first cases started trickling in sometime in April, all right? But despite such a strict lockdown, or despite the lockdown, today we have reached more than 60 or 70 lakh cases. So, how did it happen? It happened because in the early stages, we were not testing enough people who had symptoms. We had a huge bureaucratic, what should I say, line to go through. There was a huge bureaucratic tangle to go through just to get yourself tested. You had to report to a nodal officer. The nodal officer would take down a questionnaire of 22 questions. Even if one question out of that turned out to be a no, you were not authorized to have a test. Look at the time when the private labs, or the testing facilities were extended. So many patients just escaped through this testing net, and it got spread into the community. So whether we like it or not, whatever the statistics say, we are today faced with a community spread. Today, my parents are restricted to their homes. They are aged, they are 80 plus, nearing 80. They don't leave their rooms, forget their homes, and yet they are getting infected. I cannot give you a more tangible evidence of community spread. All right. So when it is there around you, when you don't really know still as to how it is getting spread, my sincere request to our fellow citizens is, please curb your instincts. Please curb your festivities for this particular year. This is a year where we really need to show our faith in the doctors, in the nurses, in everybody who is trying to maintain a modicum of service so that humanity can survive. If at all today we need to show any respect, let us not show it to an idol. Let us show it to people whose actions are speaking louder than words. Let us, have this festival time to instill a sense of feeling good amongst each other by appreciating what people have done for us. It could be my parents who have brought me up. It could be my teacher who has, put me on the right path. It could be my friends who have been with me through thick and thin. It could be anybody around me who has had a positive influence in my life. We scarcely stop to think about these people. We scarcely stop to show our gratitude to these people. We become aware of the impact that they had after they are dead and gone. Rather than that, while they are alive, let us use this particular festival to show our obeisance to people who've, brought us up, who've, had a positive impact on our lives. And at the same time, let us pledge that we will not do anything which will endanger their lives, which will endanger my family's life. I cannot say that for 50 years of my life, I have had the good fortune of enjoying every Durga Puja in the best manner possible. My parents have bought me the best clothes. They have taken me for an outing. I have had the whole night rides with all its excitement as a teenager, as a youngster. I would love to be that once again. But for this year, let us just be thankful to any supreme power, if there is any, for all that we've already enjoyed and restrain ourselves this year. We have seen what has happened in Kerala. After the Onam festivities, infection rates have gone up 7 times. And mind you, Kerala's Onam in magnitude is nothing compared to our Durga Puja festival. Let us take a leaf out of the Maharashtrians' book and see how they observed Ganesh Chaturthi this year. They were so restrained. They had no option. They had people dying left, right, and center. So they had no option. So let us not have that realization after Durga Puja. Let us have that realization before the festivities kick in. Let anyone say whatever they want to. But today, if we have to be grateful for whatever lives we are leading, let us show that through this festival to the people who really matter to us. Get in touch with them, pick up the phone, speak to them, get the digital media to be in touch with them. But please, this is an honest appeal to everyone. Avoid crowds. Avoid going out to places where you have the risk of transmitting the infection, because everything said and done in a hugely population dense country like ours, একটা শ্রীভূমির পুজো হলে, you don't expect there to be a 6 feet gap between two people. You don't expect everyone to be masked. You don't expect everyone, each and every person over there to not be carrying the virus. Even that is important for everyone to realize. So once you have this realization, I think I have complete faith in the survival instincts of my fellow citizens, and I'm sure they will ultimately realize that what is good for them. Yes, Shuchi.
I think the two main points, what you mentioned, it really touched my chord. One is respect, respect for other people. Because I think from the time that we have been into this pandemic situation, the only thing that has come up again and again is we are wearing masks not just for ourselves. We are wearing it to protect others. So I think if at all this pandemic has taught us that we do not need to live our lives exactly the way we were living, buying everything, going out, enjoying that much, we can very much do it in little bit of self restraint. So self restraint, respect for our fellow human beings and our family, friends, children, everybody, and realization, yes, that this is just one time. Probably 2 years down the line, like you said, 1 year after the vaccinations are imposed or started, so we have time to do all that if only we show these 3 points, realization, respect, and restraint. I think we can put it in that way as 3 R's. If we can do that, then we can definitely beat this as a community, as humanity, absolutely. Thank you so much, Dr. Ghosh. If you have any
My
any concluding words, please feel free, or I think we can wrap up today.
I I think so. You summarized it perfectly well. Let's follow the 3 R's. I think, all right.
Yeah.
Let's show restraint. Let's show respect, all right. And let's just be very grateful for whatever we are today, all right. Okay.
Absolutely.
Me having this internet connection, this ability to communicate with you, with well-meaning people like you, this willingness to do something for our fellow citizens. Let this permeate into every individual. Let everybody try to help out at least one person who is in need. I think so. The true spirit of the festival would come out through these small measures that all of us, can do and take on our behalves.
Yeah, absolutely. I think
And
we can spend our budget of whatever was for the festival. Why not? So everybody tells that I am not in a position to help and go out the NGOs. So I am connected with two NGOs, and people tell us that a lot of often. So I think today we can, personally, I can say that I can take my puja shopping budget or the going out budget, and just I don't have to add anything more to it. Just that exact budget, what probably I keep aside for vacation or for anything else that I am saving this year. Maybe I can give this exactly this amount to someone needy and help them out. I think this is a true test that we can have today.
মানে বেশি দূর দেখতে হবে না, মানে জাস্ট নিজের আশেপাশে প্রতিবেশীদের মধ্যে দেখো, আই এম ভেরি শিওর দের আর পিপল হু আর সাফারিং, ওকে, মে নট বি কোভিড, there may be an elderly person who hasn't had a diabetes checkup for 6 months, all right, okay, help that person, to access medical needs. There may be a person who hasn't been able to go to the bank for say 6 months. সে টাকা তুলতে পারছে না, সে জানে না how to do an internet banking and stuff like that, all right, okay, try and help that person out, all right. um, give some small loans to people who are working at your home, all right. And happy pujas for everyone, okay.
Yeah, happy
Just
pujas to you,
happy pujas
everyone.
to everyone. Let there be a smile on every face, all right, not because we are standing with folded hands in front of the goddess, but maybe our deeds can also bring a smile to everyone's faces.
Thank you so
Okay.
much. Thanks you once again,
My
and
pleasure. My
we'll
pleasure,
post it
Suchi.
across.
Thanks a
And
lot.
thank you so much. Thank you.
My pleasure. Thank you so much. Stay well and stay safe. Thank you.